morning, everyone, and welcome to the 10th SEARCA Online Learning and Virtual Engagement Webinar, or SOLVE for short. So we are now in the 10th edition of our SOLVE webinar. So this SOLVE webinar series is SEARCA's immediate response to the emerging impacts of the COVID-19 global pandemic on food security by maximizing the use of information and communication technology platforms to inform, to educate, and share evidence-based technologies and solutions, as well as tested technologies or best practices on the ground. My name is Kim Bantayan, and I am a program specialist of the Training for Development Unit of the Education and Collective Learning Department. The short video shown earlier has given you a glimpse of what SEARCA is all about and what we do. But if I may add, SEARCA is hosted by the Philippine government on the campus of the University of the Philippines, Los Baños. So we are coming to you live from the Los Baños, Laguna, the science and nature city of the Philippines. A couple of weeks ago, we started our three-part webinar series focusing on One Health, eco-health approach in solving emerging diseases, where we invited a distinguished panel of speakers who gave us an overview of One Health, eco-health approach and highlighted the urgent need for a cross-sectoral and interdisciplinary collaborations to develop a more holistic approach to health among different stakeholders at the human, animal, and environment interface. Today's webinar, the third and last part of our online learning discussions on One Health, eco-health, and joining us are experts on One Health research and animal health surveillance systems from the Philippines, Thailand, and Indonesia. But before we proceed to our online conversation this morning, please allow me to just quickly go over some very interesting statistics which we gathered from the SOLVE webinar held last June 24, 2020. The infograph shows that 72% of our online viewers were female and the rest were male. This has been the consistent trend over the past 9 SOLVE webinars that we've had, where women consistently dominated our online attendees. The infograph also indicates that more than 200 individuals tuned in via Zoom, while more than 700 viewed the webinar through SEARCA's Facebook page. And lastly, we are happy to know that we've had online attendees not only from the Philippines, but also from Indonesia, Thailand, the United States, and United Arab Emirates. This shows the number of individuals and countries that SEARCA's webinar has reached so far. We are trying our best to be able to reach as many individuals and farmers and farming communities as possible through this online platform and really make a difference in the lives of our stakeholders, especially during this COVID-19 era. Now, going back to today's webinar, you will see our lineup of speakers on your screen. After my introduction and short or few housekeeping points, our first speaker, Dr. Synan Baguio, will be presenting PCAARRD's R&D priorities in response to the COVID-19 pandemic and to the current animal health concerns of our country. Dr. Sam Joseph Castro follows with this presentation about the Bureau of Animal Industry's African Swine Fever Control and Prevention Program. On the other hand, Dr. Muharram Hidayat will share with us Indonesia's integrated animal health information system, known as ISICNAS. Also joining us in today's webinar is Dr. Sirikachorn Tangkawattana of Thailand, who will discuss the topic on One Health perspectives against emerging diseases, lessons learned from LAWA model. The question and answer session follows at the end of all the presentations. Before we begin with the webinar, I would like to cover a few housekeeping topics. During the presentations, we invite all of you to send in your questions via the comment section if you are watching us through SEARCA's Facebook page. And if you are registered and tuned in via Zoom, please post your questions or comments in the Q&A section that you see at the bottom or top of your screen, depending on the gadget you are using. We will collate the questions, and once we are in the Q&A session, our speakers will address them in the time remaining. May we request you to kindly indicate your location and/or country of origin now. It would be good for us to know where you are watching this webinar. We encourage you to please like SEARCA's FB page by pressing the little thumbs up sign just below the cover photo for us to remain socially connected. By liking our FB page, you will regularly receive updates on our learning events, webinars, and postings on recent developments in agricultural and rural development. Please note that today's webinar is being recorded and will be made available via SEARCA's FB page and YouTube channel. Today's presentations will also be made available on SEARCA's website at www.searca.org. So just check our website from time to time. The slides shown during the past 8 webinars are already posted on our website. Moving on to the webinar. Our first speaker is the Chief Science Research Specialist and Director of the Livestock Research Division of the Philippine Council for Agriculture, Aquatic, and Natural Resources Research and Development, or PCAARRD, of the Department of Science and Technology. He is a member of a number of in-house and interagency working committees for the development of the livestock and poultry industry. He is currently the president of the Philippine Society of Animal Science. The screen is yours, Dr. Synan.
Thank you very much, Dr. Kim. Before I start, I would like to apologize because my computer has been telling me that my connection is unstable. Can I now start sharing my screen?
Yes, Dr. Synan.
All right, thank you very much. All right, for this morning's activity, let me present to you the amended, I would say, R&D priorities of the Livestock Research Division of the DOST PCAARRD to adapt with the COVID-19 pandemic. And this will be the outline of presentation, the Livestock and Poultry Industry Strategic Program, programs rather. This is where we base the priority R&D areas that we have, and then followed by the Galin Program contra COVID-19. This is the DOST PCAARRD's response to the COVID-19 pandemic. And last, and I think the most important part, is the livestock and poultry priorities under the Galin program. Now, just to give you appreciation of the DOST PCAARRD's industry strategic programs, let me just share with you some of its characteristics. The industry strategic programs of the PCAARRD are commodity-based long-term S&T programs for animal industries. Take note, it is focused for the development of animal industries, which include the swine, chicken, duck, dairy, goat, and feed resources as industries considered as priorities. It is also a blueprint that operationalizes DOST PCAARRD's S&T, the Science and Technology vision. It provides S&T interventions with corresponding resources to achieve desired targets. When we say resources, we mean R&D facilities and including human resource capability building. It has defined desired outcomes and pinpoint particular segments of the supply chain where S&T interventions would make a difference. And lastly, it encapsulates the propose how the DOST PCAARRD corporate plan is being operationalized. Let me just give you an example of our graphic presentation of one of the ISPs under the livestock and poultry R&D sector. This is the ISP for swine, wherein you would see in here concrete targets indicated in the ISPs. For example, to increase pig's wean per sow per year from 19 piglets to 24 piglets, and so on and so forth. Another example of an ISP is that of the duck, the layer duck industry of the Philippines, wherein we indicated the target of increasing egg production from 55% to 70%. Now, after the pandemic, the PCAARRD has to adjust or maybe adopt its priority programs. And with that, the PCAARRD launched the Galin Program. Galing in English means, depending on how it is being pronounced, it's either good if it's pronounced galing, or it may mean from if it's pronounced galing. But galing is an acronym for Good Agri-Aqua Livelihood Initiatives towards National Goals. And this program is the PCAARRD's response to the COVID-19 pandemic. The program consists of three major components. The first component, we call it the Teknolohiya Kaalaman para sa Pamayanan. This is the program component that takes care of the distribution of information materials through the PCAARRD webpage and social media platforms. We also distribute information materials in the traditional print. Another component of the Galing PCAARRD program is the Lingkod Alalay para sa Pamayanan. This is more on the distribution of relief goods during health emergencies and calamities. And the third, which I think is equally important with the first two components, is the Pagkain at Kabuhayan sa Pamayanan. This is focused on food production and livelihood building. And to give you an example, for example, the livestock, currently we are implementing the village-scale chicken meat and egg production system. Now, all these three components put together, we feel that this will help achieve food security. Moving on, under the Galing PCAARRD program, the livestock and poultry R&D priorities now are as follows. First, is the development of village-scale livestock production systems. This is to adapt our communities to the new normal that we will be pursuing after the COVID-19 pandemic. We know for a fact that significant changes will be observed during and after COVID-19. Among these are diversity in food consumption, which will, of course, influence production. Thus, food production will also be diverse. And the recent trend is showing us more of the digital marketing system, which is providing opportunities, I think, to our small-scale livestock producers in any part of the country. Another priority is the native animals breed development, improvement, and profitable utilization. This is to conserve at the same time utilize profitably our native animal breeds in the Philippines. When we say breed development, the objective here is to transform our mongrel native animals into breeds of native animals with uniformity and predictable production performance, as well as consistent product quality. Another area of interest would be enhancement and field application of assisted reproduction technologies, particularly for dairy animals. Another area is the development and field application of molecular methods of selection and breeding. Next would be enhancement of nutrient or feeding value of locally available feed resources, and then followed by forage production, preservation, and utilization. Now, we also consider as priority primary processing, packaging, and innovative marketing of livestock and poultry products. At this time, the focus is more on milk and on eggs. Also, establishment of food quality and safety assurance systems is considered priority under the current R&D priorities of PCAARRD. Assessment of the impacts of disease outbreaks, particularly ASF and COVID-19, on livestock industries and on industry players. We also considered as priority animal disease surveillance, diagnosis, prevention, and control strategies, which include development of practical biosecurity protocols for small animal farms, development and field testing of the nano-gold lump test kit for ASF, the whole genome sequencing of avian and swine influenza viruses, and evaluation of antigenic differences among ASF virus isolates. I think this will be the end of the presentation. Thank you very much. And if you should have further, if you need further details, you can contact us through these contact numbers. Once again, thank you very much and good morning.
Thank you very much, Dr. Synan Baguio, and also good morning to you. We will go back to you during the Q&A session of this webinar. And thank you for sharing with us DOST PCAARRD's Galin contra COVID-19 program. Galin is, as Dr. Synan said, mentioned, Galin is an acronym which stands for Good Agri-Aqua Livelihood Initiatives toward National Goals. And Galin is a Filipino term which means healing. It could also mean excellence, depending on how you pronounce it, but it's a Filipino term. So thank you also for sharing with us PCAARRD's livestock, industry strategic programs and R&D priority programs, especially during this COVID-19 pandemic. Thank you so much, Dr. Synan. Our next speaker is Dr. Sam Castro, who is currently the chair of the Bureau of Animal Industry's African Swine Fever Control Task Force, or BAI ASF CTF. This task force, which is under the office of the Director of the Bureau of Animal Industry, we had him as our one of our speakers during the last webinar, Dr. Ronnie Domingo, works with the local swine industry and other relevant stakeholders for the prevention and control of the entry of meat products that are infected with ASF. Dr. Sam is a veterinarian by profession, and he holds a Master of Veterinary Public Health from Chiang Mai University, Thailand. Here to tell us more about African swine fever and what the government is doing to prevent its entry and what we can do as citizens to help. Please welcome Dr. Samuel Joseph Castro.
So good morning, everyone. And I'd like to thank SEARCA also for the opportunity for us to continue our engagement in presenting the government efforts on African swine fever. Um, to you. So this would be a continuation also of the presentation of the director during the last webinar, which focused on One Health. Now we would be speaking about the government efforts, the specific government efforts on the program, the different components of the African swine fever control and prevention program. So I'd like to share my screen. Yeah, so as mentioned earlier, this is the African Swine Fever Control and Prevention Program in the Philippines, and I am Dr. Sam Castro, the chair of the BAI African Swine Fever Control Task Force. This is the dedicated team looking into the problem and coordinating the different activities of the Philippines when it comes to African swine fever. So just a very brief background. I believe that Director Domingo already presented this. A brief background of the swine sector in the Philippines. The swine sector is prevalently small scale. However, of course, it remains a vital source of economic growth. And as you can see from the various figures here, I don't really need to read them out, that really the Philippines is a swine consuming country. And the social inclusion here is that 65% of the 12.7 million inventory of swine in the Philippines is produced by backyard and smallhold producers. So this is where you will later see where the government is focusing its many of its assistance being given. So this is a 260 billion industry, but if you include all other industry, the allied industry, it may go well beyond 400 billion pesos. So it is a major contribution, of course, to agricultural production. So the dynamics of African swine fever, just very, very briefly, so that our viewers have a background, is that ASF itself has, it says here by the FAO that its morbidity is low, 10%, mortality is 9%. However, once an animal gets or is affected by ASF and is symptomatic of ASF, the case fatality rate is 90%. So it is highly resistant. The nature of the virus is that it's highly resistant to environment, survives freezing, and survives pH. These are the different characteristics of the virus itself. What's very important to know here is that there is no vaccine at the moment and no treatment. So given these characteristics of the virus, that the morbidity and mortality are low, and they even say that some studies have also shown that the infectivity range of this is just around, I think, around 3 meters. How come ASF is spreading in the Philippines as well as the other countries? So to your right, you can see the various risk factors that are contributing to the spread. So if you read through all of this, direct contact, the presence of spill feeding, the movement of vehicles, feed, contamination of feed, people and fomites, mechanical vectors, environmental contamination. These are the very risk factors of ASF spread. You can see that it has become, if you may, a human-driven. So it is the practices that we have which are contributing heavily to the spread of ASF. So this is where we are also focusing our interventions in addressing such risk factors. As you can see here, this is the survivability of the virus. In frozen meat, it can survive for 1,000 days. So you can see here the different the number of days in which it can thrive in inanimate objects. Okay, so the cross-cutting issues when it comes to the Philippines, as well as I believe this can also be applicable to other countries, is that it is a social issue anchored on poverty. For instance, the use of swill. Swill is, or in the Philippines we call it kaning baboy. It is what our predominant industry of the backyard farms is what they use in feeding our swine. One issue here is that cost of feeds is prohibitive, because if you compare it with like one sack of swill, which is 150 pesos, you compare that with the cost of feeds, which is around 1,500 pesos per sack. So the poorest of the poor would automatically deviate to using swill because of the cost is prohibitive. Okay, so this is for those who those who could not afford to consistently use feed. So uh, the nature of people who would that we would tend to buy cheaper products, but the the need for checking if this is there are documents or are these inspected. These are put on uh, these are secondary compared to trying to save, right? So it's consumer will always buy cheap pork and pork products. And of course, economic, the instinct of farmers who have been hit by ASF is how can they immediately recover from the investment. This is both for backyard as well as commercial farms. Then there's always unscrupulous traders who buy at the lowest farm gate prices but sell at retail prices. So this is unscrupulous, or we can term them as like predatory trading. There's always the presence of that. So these are cross-cutting issues that have to be addressed. And in the theme of this webinar is that we have to address things at a one health approach. We have to approach such problems in a multidisciplinary approach. It's not just the agriculture side or veterinary side who has to act. It has to be a whole of the government approach. So this is um, the number of cases and some figures from the outbreak that has happened in the region. So it shows here China, Vietnam, South Korea, and the different other regions, including the Philippines, that have been hit. And this is the ASF situation in the Philippines. So we are employing a best practice from our previous animal disease control activity programs in the past, such as the foot and mouth disease eradication program, which we have been successful. We have eradicated foot and mouth disease. So the practices that were successful then are being carried on now. This includes zoning. Okay, so the Philippines is divided into very different zones according to the disease status. So I'll be explaining this a bit later. Okay, so this I'm showing you right now, and this is a dynamic representation of how the areas that have been hit in the Philippines through since it was reported in August 2019 to date. Yes. So these are the various areas that have been hit. As you can see here, it was initially confined in Luzon. Then in late February 2020, some areas already in Mindanao had been hit by African swine fever. And to date, there are continuous reporting of cases, and the government is trying to work with its constituents to contain this disease. Okay, so ASF in numbers, this is as of June 26, 2020. It has hit 8 regions. When I say regions, it's administrative regions in the Philippines, 230 municipalities, 25 provinces, 1,003 barangays or villages, and the number of culled animals by culled animals is 299,956. So this is consistent to what we have been reporting also to the OIE, because it is the country's obligation to report figures to the OIE when it comes to African swine fever. Okay. So as I mentioned earlier, the government is employing a whole of the government approach versus ASF. So the National Task Force on Animal-Borne Diseases, or the NTFAD, was created by the president himself in order to address African swine fever and other animal-borne diseases. And the primary purpose of this task force is to oversee, implement effective, coordinated policies and strategies to manage, control, and spread of such diseases. So as I said earlier, it cannot just be addressed by one discipline or one department alone. It has to involve various agencies and various disciplines. So it is the whole of the government approach that is being employed to address such complex and big problem. Okay, so these are just some of the some of the government interventions. We have laboratory testing for African swine fever in our national laboratory as well as the regional animal disease diagnostic laboratories. And to assist us, we also have the recognition of private sector laboratories for ASF testing. We do have an indemnification fund. So this is to assist backyard farmers. Okay, so I make it clear. It is to assist the smallhold farmers to be able to recover. This is from the President's Contingent Fund for Indemnification Operations, and this is the fund allotted. As the DA, Department of Agriculture, also has a quick response fund on standby to help affected farmers. So we do continue to coordinate the various activities of our DA regional quick response teams or local government task forces. The DA also has a loan program. Initially, this was for rice farmers, I believe, and now it is open for hog raisers to be able to cope with the current problem. And we are now also starting in some areas to have post-outbreak animal recovery packages. So this is the procurement of various animals and farm inputs for distribution. Okay, so I'll probably skip some of these as we would like to focus more on the different activities. So the BAI, as I mentioned, we have a dedicated team, the BAI African Swine Fever Control Task Force of the Bureau of Animal Industry that conducts the various activities in order for us to contain and control the disease. So the various activities included here are technical and logistic support for disease control and prevention activities of DA quick response teams. So if for participants, we would like to explain that the Department of Agriculture has different regional offices in the Philippines. So we must understand that the Philippines is an archipelago, and that archipelago has different regional regions. In fact, we have 16 administrative regions, and each of those administrative regions has a DA regional field office. For us to be able to contain, to address such a problem such as ASF, activities such as this have to be cascaded down to these regions and down further to the local government units for them to be, for there to be a coordinated approach from the national down to the grassroots level. So activities include disease investigation, depopulation, as well as, very importantly, what happens after the disease investigation, depopulation is cleaning and disinfection of infected premises. The task force also oversees the implementation of disease monitoring and surveillance activities and managing an epidemiological database on African swine fever. So earlier, I was talking to the organizers about what we would want to highlight also when it comes to this presentation. And I have a few slides here very specific to surveillance that is being done particularly for African swine fever. So according to our ASF emergency management plan, these are some of the requirements for us for an animal health surveillance activities to be effective. So I highlighted in some of here the key points. Okay, so there should be a regular communication between government and private sector stakeholders. So as I said earlier, in the Philippines, we have a system of having regional, provincial, municipal, and village authorities. So what we need to do here is for the government to be able to cascade all the different activities from the region, from the national down to the grassroots level. It has to be that inclusive. So regular communication is paramount, of course. capacity building at the different levels in surveillance principles and coverage. So this actually has been ongoing already, even beyond, even before we had African swine fever. Capacity building has always been part of the mandate of the or the activities of the PAI to equip our regional, provincial, and local government counterparts to disease recognition and quick response. Okay, so there is also regular disease reporting. There needs to be a regular disease reporting mechanism and immediate reporting, especially for unusual cases such as African swine fever. And in order for a surveillance system to be functional, there should be a functional animal health information system. In the Philippines, we have what we call PhilAHIS, or the Philippine Animal Health Information System. And of course, to support the various field activities and the technical activities being done, there should be a functional laboratory system. Later, I will show you a map showing the different regional animal disease diagnostic laboratories capable of testing for African swine fever. So in order to have successful, or we may say efficient or functional animal health surveillance application, these things should be in place. So as I mentioned earlier, we do have some form. We do have systems already in place for the Philippines. However, of course, when it comes to diseases such as ASF, we do have to adjust according to the nature of the disease. So the forms of surveillance already currently being conducted, actually even before African swine fever, are these. So there is negative monitoring. These are negative reports provided by our local government unit counterparts. There are, let's say, village animal health workers reporting to municipal veterinary authorities, who in turn report to the provincial veterinary offices on areas that have been monitored and there was absence of disease. So we can consider this negative monitoring, because negative reports provide evidence of that there is ongoing surveillance, and it also provides evidence that disease during that time of surveillance is absent. Very important also is farmer reporting. This is where collaboration between the private sector and the government comes in, because there has to be a constant communication between constituents or farmers and the government. This is very important. It's very simple form of communication, but very significant. Abattoir surveillance, this is in coordination with our colleagues from the National Meat Inspection Service, who from time to time report cases of during antemortem inspection in abattoir. They see they encounter cases that are similar to African swine fever or suspect of African fever. It is immediately reported to BAI, or the Bureau of Animal Industry African Swine Fever Control Task Force. And of course, the best way to do surveillance is to conduct surveys themselves, so collection of samples. Currently, since we do have ASF cases ongoing, what we do is active surveillance around the areas that have been affected by African swine fever to find out the extent of the outbreak. So that is the type of active surveillance we are currently doing. So these are just the various forms of surveillance which are currently being done here in the Philippines. Okay, so this is just to show you the mechanism for reporting of not just African swine fever, but different animal diseases as well. So there may be field reports of sick animals, and you can see here different various layers where it can be reported. So routine reporting is usually from the grassroots up to municipal, to provincial, to regional, then to the national level. However, when it comes to disease outbreak investigation, stakeholders are encouraged to report anywhere. Actually, they can report at any level, but what's important is that report is immediately cascaded to the different levels as well, in order for it to be an inclusive response. Okay? So this is the the mechanism for reporting of diseases, animal disease particularly. So equally important to our technical activities, our disease monitoring surveillance activities, as well as quarantine activities, equally important to that is informing stakeholders. During the foot and mouth disease eradication program, a phrase was coined. It says that um, an an informed public is easier to mobilize. Okay, so once that the public or stakeholders know their role in on what they can do to help in a campaign, it is easier for government to be able to enjoin our stakeholders to help to assist. So that's why we are considering information, education, and communication, or IEC, or public awareness, as equally important to the technical activities. So there are awareness campaigns of stakeholders being developed right now, and currently, very recently, we have developed local IEC materials for distribution to our different um, uh, to our to our different stakeholders. So these are just samples of it. And very importantly, since the Philippines is it's a country of various languages, I think we have 187 languages with 5 major languages. We have, with the help of our regional African swine fever coordinators, we have translated these AEC materials into, I think we now have 7 languages: Tagalog, Ilocano, Cebuano, Bicolano, Waray, Chapacano, and Hiligaynon. So this is very important, particularly for the Philippines, because it is important to have the widest reach possible for our stakeholders to be informed. So translation of such materials is very important. Other IEC activities, we are adapting various ASF communication tools, particularly that of the World Organization for Animal Health, or the OIE. Yes, we have adapted it in the previous campaign, which you see in the middle, but currently there's a campaign which is entitled ASF Kills Pigs, and we are adapting that also right now, and we are in the process of translating these materials into the local languages. Again, as I emphasized earlier, it has to be translated in order for us to have the farthest reach possible. Okay. So as mentioned earlier, this is a map showing the expansion of ASF, various ASF laboratory services around the country, and included in the regional animal disease diagnostic laboratories and our national laboratory are 4 private sector laboratories recognized for ASF testing. So this is a partnership that's very important in order for there to be collaboration between the government and um, the um, the private sector. Okay, just some ASF related activities. We have various teleconferences, as well as you see we like everybody else. We do have to adapt, and we do have to adapt to the current situation. The current situation warrants us to have, instead of physical meetings, we have meetings such as this. We have webinars, right? So we have to maintain our engagement. So every 2 weeks we do have meetings with our national, regional. No, the national, the team has a meeting with our regional ASF coordinators in order to have regular updates and regular discussion of various issues encountered. So we have to maintain engagement regardless of, despite of the COVID situation. We have to adapt how we engage. Okay, so other, yeah, this slide shows the continuous capacity building of our regional coordinators, our coordinators have recently completed an online course of the Food and Agriculture Organization and EUFMD. So this is to continuously capacitate them and our teams as well. Okay, so these are just the various issuances relating to ASF since it began in 2019. So this just goes to show that with the different activities going on, we do have to adapt also our legislations as well as issuances. So this is actually very important because this is the National Zoning and Movement Plan. If you remember, I showed a map earlier showing the Philippines divided in different zones according to disease status. So this plan was signed by the DA Secretary and also signed in February by the President of the Philippines himself. This is very vital because it shows how important zoning is. It shows how important that a whole of the government approach is implemented in order for us to address this. So this zoning plan and the zoning map is regularly updated to reflect the actual disease status of regions or municipalities in the country. This also dictates what is allowed where when it comes to animal movement as well as product. Okay, so again, these are just different issuances which show that strategies have to adapt, and those strategies have to be backed by correct legislations and issuances. This is the 1710 protocol, which initially was initially developed during the beginning of the outbreak. So each infected zone would be surrounded by a 1 kilometer radius to contain the infection. That's what we call the quarantine zone. A 7 kilometer radius, which is called the surveillance zone. This is to detect the extent of the infection, and the control zone, which is the 10 kilometer zone, to detect infection at an early stage. There is mandatory reporting in this zone. So again, we had to adapt this to the current situation. And previously, there is the mandatory kill zone, if you may, mandatory depopulation zone of 1 kilometer. This was reduced to 500 meters. However, 500 meters and beyond, that would be where surveillance is done. Okay, and this is the response framework. It goes to show how we have addressed ASF, how it has evolved. Because in 2018 to 2019, early on, we already had a strategy against African swine fever, which mostly focused on prevention of entry of ASF into the country through strict quarantine measures. Okay, so when ASF hit in 2019, we had to adapt as we have to do, right? Because it had to adapt to addressing, to controlling the disease in the areas that have been hit. At the same time, still protecting zones that are still free from ASF. And the plan for 2020 to 20 in the next few years would be for us to be able to recover from African swine fever. And if you can see here, this is a list of various activities wherein there is cooperation. There should be cooperation, more cooperation between the private sector as well as the national government as well in implementing ASF control activities. And this also has to involve the different agencies as well. Okay, so for my last slide, it's just the various ways forward that we are considering is to, of course, to sustain technical assistance and logistic support to overall efforts of our regional quick response teams and local government units. The number two is really vital because we have to adapt activities. What I'm trying to say here is that despite the challenge of having community quarantine resulting from COVID, activities on animal disease and prevention should continue. We have to adapt the strategies. We have to adapt to the current situation. So we have to be creative in doing such activities and continuing disease prevention control strategies. And of course, owing to the One Health approach, the need for a One Health approach and to support the whole of the government approach, there needs to be coordinated action. There needs to be continuous coordinated action to address cross-cutting issues with relevant Department of Agriculture agencies and the other agencies as well. So this is in line with a One Health approach of approaching animal diseases. So with that, I'd like to thank you very much for, again, for the opportunity for us to be able to share our activities. So thank you for your attention.
Thank you very much, Dr. Sam, for enhancing our understanding of the dynamics of African swine fever infection, how the virus spreads. You also presented to us the social issues anchored on poverty, as well as the economic issues that need to be addressed through the One Health approach to prevent the spread of ASF. And also, it is good to know that the government is trying to contain the virus, to contain this disease through the whole government approach. And it is also heartening to know that the government is also implementing various programs to support those farmers who have been affected by ASF, including intensifying IEC, information, education, and communication, distribution and dissemination. Dr. Sam also presented to us the requirements for effective, efficient, and functional animal health surveillance applications. I hope you also remember the 1710 protocol and also the LIEMPO control responsive framework to prevent the spread of ASF. LIEMPO is another acronym, but I failed to write down the meaning of M, but LIEMPO stands for locate and call, improve surveillance, education. What does M mean, Doc Sam? Is it mobilization? Education, and P, protect, free zone, and O means optimize, what do you call this? Optimize biosecurity. Thank you so much.
M is for mobilize stakeholder support. Yeah.
Okay, I got that. Okay, mobilize stakeholder support. So that's LIEMPO. Okay, that's one of my children's favorite food, the LIEMPO. Okay, so much for that. From the Philippines, we go to Indonesia. Our next speaker is Dr. Muharram Hidayat. He is a senior veterinary officer of the Directorate General of Livestock and Animal Health of the Ministry of Agriculture, Indonesia. He has been working on animal health surveillance and is currently in charge of ISICNAS, which is the National Animal Health Information System of Indonesia. He is a doctor of veterinary medicine by profession, which he obtained from Bogor Agricultural University. And he has a master's degree in veterinary epidemiology and economics from Utrecht University in the Netherlands. Dr. Andy will tell us more about ISICNAS and how it became one of the most sophisticated and responsive animal health information in the world. Over to you, Dr. Andy.
All right. Thank you again for SEARCA for the opportunity for us to share about our integrated real-time animal health information system. This is a pleasure for us to have this opportunity. And for introduction, this Philippines is neighbor from Indonesia, so you know our country is quite the same. We are archipelago, and we have 34 provinces in Indonesia, and more of 250 million population, and more of 17,000 islands in Indonesia. As you see, this is a challenge for us to gather information, not only for animal health, but for all sector. It's a challenge for us to gather information from the village to the district and to province and to central level. So with this information system, we have a change of conventional reporting. Previously, the officer should report to the district services, and district will collect all the farmers and then wait until all collected from the farmers or the officer, and send it to the provincial. So, and then the provincial also wait from all the district to gather and then send to the central government. And from our evaluation, this process could take from 1 week to 1 year delay for the data to get to the central government. And when it comes to the central government, it is we cannot do anything because it's aggregated data, and we only know that it is from these provinces, not detail of village or when it happened. We are difficult to get the information. So with the new reporting scheme, all the farmer will and the officer will send all the reports to the ISIGNAS. This is our integrated information system, and all the district, central government, and the provincial government, and the officer itself who send the report can see the data, and they have the response real time. And the principle of this ISIGNAS is real time. So and we are capturing atomic data, so small data in ISIGNAS, and it's integrated with other reports. So in the later on, I will have the slides of the reports in ISIGNAS, and reporting every event of the disease. And we have this notification scheme to everyone who needs it. So when the disease occur and the officer in the village report to the ISIGNAS, the report will have a notification to all veterinary in the district. So in the district already alerted about the disease. And we are using a technology available. So we are using several channels to report to ISIGNAS. From the simplest is the SMS, and then now we have the Android apps to report to the ISIGNAS. And this is the initiative of the ISIGNAS. It started from the partnership between Indonesia and Australia. We started in 2011, the partnership, but the ISIGNAS initiative started in 2012. And now the project is ended, and all the maintenance, all the cost is now provided by, fully funded by Indonesian government. So as I said, it's initially designed for common disease reporting from the village and the farmer and the officer. But now we have a report for priority disease, slaughterhouse, treatment, laboratory, field surveillance, distribution of nitrogen, distribution of cement, the vaccination, animal movement, animal ID, artificial insemination, abortion and pregnancy tests, and other things. And besides this, we have also for management reporting. So now it's been used in 34 provinces in Indonesia. Now all districts have used this information system. And now the traffic is in ISIGNAS is registered more than 7 million farmer in the system, and 22,000 registered officer, and we have about 8.9 million report per semester, one report per 2 seconds. So per 2 seconds there is one report coming, and up to 2,000 login per day. So every time people want to access the data, they have to log into our website, and we have about 2,000 login per day, especially at the end of the month because they use it for the budgetary and something. And beside we use the SMS, we use all the channels that people can use. So we use Google Hangout. We developed the eSickness mobile apps, and there's another eSickness AIMS. This is for animal individual management system, and we have a web browser based, which is we call it Realities. So all this channel can come to eSickness, and to access the data, officer or users can send SMS to the system, and the system will respond their query. And we have also automatic email. So based on what they need, if they need a disease report, so we send automatic email to them daily or weekly or monthly. We can set it. Or we can download the data and access the data from the website and download in CSV files. So this is just the preview of the web. So we have a chart and we have a map of the event, and we have also the table of the detail of the event recorded. For the disease reporting, if the report is already confirmed by the animal laboratory, it will become red in the map. And this is for the animal movement. We can see this is where animal is transferred from and where to the destination of the animals. And if we click it, then we can see who's the owner and what type of animal, how many animals, and this. If we click on this blue number, this is the ID of the animal movement. So we will have more detailed information on that. And this is some graph of the disease chart in what happened in Indonesia. And as we see in the previous speakers, Dr. Samuel mentioned about defining zones for surveillance. In the system, we can also define if a village get infected and become a zone of affected zone, so we can establish how many kilometers surveillance zone or control zone and in the system. So if we click on the blue, we can see which village is in that zone. So we can see how many animal in the village, and we can prepare for the vaccine. We can prepare for the medicine that we need to control the disease in this surrounding area. And this is the animal slaughter figures, maps in Indonesia, and we can also see each spot is one slaughterhouse, and the colors represent what type of animal is slaughtered in that slaughterhouse. This is, I think, my last slide. This is how to I want to highlight that this system already integrate with other information system that we have in Indonesia, and in terms of One Health, this system also now we are piloting this. If you see in the bottom of this slide is the CISE. This is the zoonotic disease and emerging infectious disease information system. Which is a portal that we developed in Indonesia to connect the data from our side, which is the livestock, and data from forestry for wild animal, and also the data from human health for zoonotic disease. We piloted all in the provinces now for one disease, rabies. So hopefully we can have information real time if someone get bitten by a dog in one village. So the information from human health will come to ISIGNAS, and our officer in that village or in that district can respond and find the dogs and do some response that they require. And vice versa also, if we have an outbreak of bird flu in one village, so we can also send the information back to the human health, so they can prepare if someone come to their health facility with a fever or something in that village. So we can have more alert system both in human health and animal health. I think that's all my presentation for this. If you have further questions, I'll be happy to. Yeah, thank you.
Terima kasih, Dr. Andi. Thank you so much for sharing with us ISIGNAS, or Indonesia's comprehensive and integrated system for collecting and managing information to support animal health production in Indonesia. So thank you for explaining to us how the entire system works in providing real-time field disease reports to decision makers at all levels, and also how it is linked to other information systems in Indonesia. Thank you so much. We will go back to you during the Q&A, Dr. Andi. Once again, we would like to encourage everyone to start typing your questions via the comment section if you are tuned in via Facebook, or the Q&A chat, Q&A box if you are tuned in via Zoom. So please post your questions or comments now, and we will collate them at the end of the presentations. Okay, so moving on to our last speaker in today's online conversation. Our speaker is an associate professor of the Faculty of Veterinary Medicine, Khon Kaen University, Thailand. She is currently doing research on Opistorchis viverrini, I hope I pronounced that right, and cholangiocarcinoma, CCA, with the World Health Organization Collaborating Center for Research and Control of Opistorchiasis. Opistorchiasis is a tropical disease caused by the carcinogenic Asian liver fluke, Opistorchis viverrini. This hepatobiliary disease is known to be associated with malignant cancer and affects millions of people in Southeast Asia. Her works relate to animal reservoir and pathogenesis of Opistorchiasis and liver fluke-related diseases. She's one of the key persons in integrated control of Opistorchiasis using the LAWA model. Here to tell us more about the LAWA project or LAWA model, which is chosen to be a prototype of Opistorchiasis control in Thailand, please welcome Dr. Sirikachorn Tangkawattana.
Good morning from Khon Kaen, Thailand. Thank you, SEARCA and my friend Rico for invitation for me to sharing my experience. I would like to share my experience about the LAWA model, which is the integrated control of the using One Health, Eco Health approach for the liver fluke control of Opistorchiasis. Begin from the LAWA model. So LAWA model is the integrated control that I tell you that using like a transdisciplinary and interdisciplinary approach to control the liver fluke disease in Thailand. For the liver fluke disease, it endemic in Southeast Asia from Thailand, Laos, Cambodia, Vietnam. And for the LAWA is the name of the village and also the lake, which is located in the complex. And the complex is the environment that's perfect for the liver fluke. And the liver fluke disease can be passed to the human and the mammal by ingestion of the raw fish that have the infective stage. From this life cycle of the OV, I call OV. So you see that when people or animal eat the raw fish that have the parasite, so and then parasite can grow in the liver and the bile duct and then release the egg through the environment and pass to the intermediate host such as the Bithynian snail, the cyprinid fish, and then come to the human and the mammal again. The importance of the disease is it can cause the fatal cancer we call bile duct cancer or cholangiocarcinoma. From the life cycle, you can see that it relates to the human, animal, and environment. From here, you can see that for human, the most important is it can cause the CCA, and it related to our lifestyle and culture and the eating behavior. For the animal roles as the reservoir host. In the same time, for the snail and fish can be the intermediate host too. And for the environment, because that the parasite need the perfect environment such as the wetland, and the wetland should have the intermediate host and reservoir host to pass through the disease to complete the cycle. What have we done about the LAVA model? So we work both human, animal, and also environment. For the human, we begin from the baseline survey by checking the status of infection. We also have the health check together with the ultrasound check that can be screened for the lesion in the cancer. We also have the stool exam for the standard protocol to tell that you get infection or not. And also, if we found the infection, we can give them the drug praziquantel. Praziquantel is the drug of choice. How about the animal? We also do the same parallel to the human. So we can know that the status of animal is about how much, and comparing to the human, we do the same thing in the human. How about the environment? At first, not many people think about the environment, but from our team, we found that it has relationship with the human and the animal domain. First, we quite curious why most of the infection, the high prevalence is around the southern part of the lakes. And after we investigate more, we found that for the southern part, it has abundance of the intermediate host, the Bithynian snail, and also they have the fish, the cyprinid fish. And we study further, we found that in the southern part, the water is quite have more salinity, which that the Bithynian snail can grow very quick, and is kind of monopoly population. Other snail cannot grow in that area. And in the same time, the west from the village has the drain to the south of the lake too. So it's kind of the perfect match, and it can complete the life cycle of the liver flu perfectly. After we know the status of the infection, we done the stakeholder meeting, tell them what is the situation of the infection, and then listen from them what is their opinion, and we can plan and to solve the solution together. First of all, because that the villager did not know about the nature of the disease, so we give the health education is kind of IEC according to the WHO guideline, together with the creativity of the village people. They propose about the edutainment, which is combine the education together with the entertainment, like dancing, singing, and then they convey the knowledge using only one poster, but it can tell everything. If you know the nature of the disease, you know how to cut the transmission. Then we expect the new generation that shouldn't have high prevalence of the liver flu. So we have the school curriculum, we have the activity to tell them that it's not good to eat the raw fish that have the parasite. And the media that we convey to them can be like a cartoon for the student, but it also good for the adult too. And also we have the song that open every day in the village, and they listen every day. So the knowledge in the song can penetrate to their daily life and their member. Also, this cannot be sustainable without the government. So when it can decrease the prevalence, we invite the policymaker, the government to see what we and the village do together with other groups that working on the liver flu. So we can push to the national agenda and health policy to against the liver flu disease for 10 years. Now we is about in the, from the transmission focus to the surveillance, and we supposed to have the prevalence less than 5% within 10 years. And the trend is looking good. And we target to be eliminated in this phase in the future soon by using the integrated control, using the One Health, Equal Health approach. What we learned from the LAWA model. So the problem about the liver flu is the local problem in the northeast of Thailand and also other area in the Southeast Asia. So we have to think system thinking and like a holistic thinking. We have to know the root of the problem. We have to know the nature of the disease that related the human, animal, and environment. Also, when we work on the control, so it's not only this discipline alone. We need many disciplines and many stakeholders to get together to participate and have the same ultimate goal is to eliminate the liver flu. Of course, community participation. So for the grassroots is important because that they know they realize the problem, how much it can affect them both life and also the economics, together with the policy support, so it can lead to the sustainable health control. You can see that we begin from the local, and then after that we push to the national. Nowadays, LAWA model is worldwide, and many people who work in the foodborne parasite know about the way that we do on the disease control. We have to make sure that community have awareness, because first, they don't know about liver flu before. When we go to the village, the community, they say, oh, no one tell me before. And then we need to recruit them to participate. And then when they participate, they realize the importance, and then empower them to be strong, and they can manage by themselves. And also this can help for the health to get better. Also socio-economic of the community should be better. From this point of view, we believe that the LAWA model can be applied or modified to other foodborne disease or other problems. And it can modify or adjust according to the problem and according to the location. For the final goal, we expect the community to have the well-being and healthy. But we just found out that COVID-19 is kind of unexpected crisis that we confronting. So we have to have the new normal lifestyle and behavior. We have to do the social distancing. So it means that we have to do more remote working. How about the collection? When we have to follow the status of infection, we need to modify something, or maybe to teach the community to take care by themselves. And also for the health education, we have to reconsider about ways to live, ways to deliver, and how to make it more attractive to the local people. And I think that maybe in the future, nearly future, economic crisis should be one of the obstacle for the research. And I hope that it should not be collapsed, but we have to get ready for them. About the new normal era, the lesson learned from the LAWA model that we still can keep like the system thinking, like a holistic thinking using One Health approach and stakeholder engagement, but we have to rethink again that what way that we can engage them more. Also, the participation is the same. And for this situation, we need to empower them much more than ever because they have to sustain by themselves. And of course, the policy and the government should be backed up. Otherwise, it cannot be keep on or sustainable. We need to reconsider about the work from home, work from the remote distance. We need high technology and also maybe more multidiscipline to get together. And of course, the self-reliance should be one of the key. That's all for my presentation. The LAWA project is originated by Professor Banjop Sipa, who is the director of the Tropical Disease Research Center, Khon University. Thank you.
Thank you very much, Dr. Chorn, for your interesting and enlightening presentation on the LAWA model to control liver fluke disease in Thailand. What is interesting about the LAWA model is the conduct of, as you mentioned, the conduct of the stakeholder consultation, edutainment, school activities, use of print and audio media with the support of the government towards the total elimination of liver fluke in the near future. So thank you so much, Dr. Chorn. We now move on to the Q&A session. And again, may I remind our online attendees to please type in now your questions. We will start with the questions that we gathered from our Zoom online attendees. The first question is directed to Dr. Sam. Dr. Sam from Mamsol Villanueva of DepEd Laguna. What is the origin of the Asian swine fever? What is the origin of this kind of disease, and what is the first aid that we can give to pigs affected by this disease? I believe she has a small piggery in her town.
Okay, so yeah, thank you for the question, ma'am. It's actually when it comes to speaking of the origin of ASF, there actually is a very it is a long of how it originated in Africa. What I can tell you is that how it may have reached the Philippines. I could probably focus on that. The ASF was first recorded in farms in Rodriguez Rizal. Okay, these were first recorded in Rodriguez Rizal, wherein there is, based on the investigations, there is evidence that it may have been through swill feeding. Okay, it may have through swill feeding because the areas affected here in Rodriguez Rizal are close to the, what do you call these, the dump sites, or the dump sites, wherein there is a trade of swill, and there may be a connection between the use of swill from those from there going to our backyard farmers, because our backyard farmers predominantly use swill feed. Okay. the question on first aid, as I mentioned earlier, is that if you remember the previous slides that I showed, that the case fatality rate when it comes to ASF is 90%. So once an animal or a pig is hit by ASF, it is more likely that it will die of African swine fever already. So, which is why the government is that's why the most effective way of controlling the disease really is to stamp out or to kill the animals already, to do preemptive killing of animals already affected by ASF or showing signs already of African swine fever. Okay, so also in my slide it says that there is no treatment right now, and there is no vaccine yet against African swine fever.
Okay, thank you for that information, Dr. Sam. We have a question here from Timor-Leste. Is there any way by which we can identify? I think this one also is directed to you, Dr. Sam. Is there any way by which we can identify the meat from those affected by African swine flu?
Meat? You mean meat?
Yeah, meat from pigs, from pigs affected by ASF. Okay. Is there any way we can identify?
What we can probably see here, because for instance, if we relate it to previous cases wherein, as I said earlier, we do have surveillance in abattoir. So there have been cases in the past that we have been alerted in a slaughterhouse that shows animals with patches, like what do you call this? Like insect bites. They look similar to insect bites. Then they were tested. Then these have tested to become tested positive for African swine fever. However, the complication here is that many diseases look alike. Okay, it's much more difficult to look for it when it comes to meat. What we could probably be better look at is the other issues apart from looking at the physical appearance of meat. Is that once that you look or you find meat which is sold at a very, very low price, if it's too good to be true, it usually is. So could probably be a better way of looking into is the meat that I am purchasing at a very, very low price. Has it been inspected? Has it passed the proper inspections of our meat inspection services? That would be the better advice for people purchasing for consumers. Yeah.
Okay, thank you. So that reminds us really to look into the certification from the National Meat Inspection Service.
Yes.
So that we are sure that
this also goes to show that information to our stakeholders is really paramount. And as you mentioned earlier, information, education, communication is really it's really important for people to know what is happening and what they can do to help in the to be informed. They could know what they can do to help.
Yeah, and I think the Bureau of Animal Industry is really doing its part, in raising public awareness about the ASF. Okay, so our next question is directed to Dr. Hidayat. Dr. Andy. Dr. Andy, yes. The question here is from one of our Zoom attendees. Surveillance systems are expected to have proactive prevention of animal diseases. How effective is sickness in achieving this?
Thank you for the question. I think this is quite effective for this. It's even very sensitive because, for example, about a few months ago, we have Indonesia is free from FMD, and we have this training system and the live system. So someone is trying to send to the training, and he report FMD suspected case in Indonesia. At that time, it's 2 o'clock in the morning, So DG for the exotic disease, DG and the Director of Animal Health will get instant notification of the disease. So at the 2 o'clock in the morning, he start to call everyone in the regional and the provincial level. So it shows that the system is working very good to detect the disease in the village level. But again, our challenge is now is turnover of trained officer for this system. So we need to have a continuous budget to train a village officer and the local farmer to report to the disease continuously. I think that's a good answer. Thank you.
Thank you, Dr. Andy. This next question is for Dr. Synan. Dr. Synan, we are interested in raising, we are interested about the ETIC PINAS. How can we access support for this?
Yeah, for the one asking that question, you can kindly visit the Facebook page of ETIC PINAS, and we can direct you to our private sector producers of ducklings. We now have the capability to produce ducklings in volumes.
Okay.
So there should be no problem with that. Just get in touch with us.
Okay, so here's a follow-up question. As a key research manager and leader on livestock research in the Philippines, what key advice would you give us, especially the undergraduate or graduate students?
All right, research, very good question, very interesting, and I'm happy you are asking that question. The key advice would be to identify research areas or research studies that would show clear economic benefits at the end. Yeah, that's all I can say. When you conceptualize research project, make sure that when you finish the research project and generate the results you have, they will find use in industries and contribute to the creation of wealth or enhancing or contributing to our economy. That would be the advice I can give.
Okay, thanks, Dr. Synan. Another question from Ms. Rosel Falconites Ciudad for Dr. Andy Hidayat. When did Indonesia start their automation or digitalization of data collection? She is very much impressed with your presentation. Maybe ISICNAS, when did it start?
Yes, it started in 2012. It was a really small system, but now it became a massive system because behind the ISICNAS, we developed the Indonesian Veterinary Laboratory system also. And also we have, for influenza, we have also the influenza virus monitoring to store the genetic database of the virus circulated in Indonesia and how the vaccine distributed in Indonesia still protect the animal we have in that system. So all it's separate from the ISICNAS, but now it's integrated to the ISICNAS. So I think now all the reporting in Indonesia will start to go to the digitalization.
Okay, thank you, Dr. Andy. Back to Dr. Sam. Dr. Sam, does the Philippines an anonymous attendee, does the Philippines have any plans of adopting Indonesia's system of tracking animal movement? Do you have any program on that? The Philippine government has any program on that?
The Philippines actually has what I mentioned earlier, but not very. We do have the PhilAHIS with the Philippine Animal Health Information System, which
Oh, okay.
does have such functions, and this has actually been functional with the initially with the foot and mouth. It used to be the FMDMIS of foot and mouth disease management information system. Then it migrated. It was migrated to adapt to be able to monitor all other diseases. So we do continue to develop the PhilAHIS to be able to cover as many diseases as possible. And of course, the best practices of Indonesia in implementing such would be always be very helpful in our learning. So yeah, if there are best practices that the best practices that Dr. Hidayat had shared that information would be also very helpful in our further development of our systems in the Philippines. We do have a system.
Yeah, yes. That's good to know, Dr. Sam. And there's a follow-up question here. From Marina Lapitan Balyais, small business operators experience great demands of meat products, but less suppliers as a result of price increases. Day by day, wherein the households have been really affected as well as the operators. How can you be able to maintain enough supply during this pandemic?
So the only way that we could be able to really have to address such is through a constant stakeholder consultation. So the Department of Agriculture is in constant contact and constant consultation with its private sector stakeholders as well as relevant government agencies in order for us to address such. So as I said earlier, the government is looking into such the problems by employing not just veterinary or agriculture strategies, but it has to be a whole of the government approach. Everyone has to be involved in addressing such.
Thank you, Dr. Sam. Back to Dr. Chorn. Yes, we understand from one of our Zoom online viewers, we understand that eating fish is part of the communities living near the lake. How did your group encourage them not to eat the infected fish?
Okay, thank you for the question. So to change the human behavior is not easy, right?
Yes.
So first of all, we should let them know about how it can affect their life. So when we go to the community, we have the human specimen, the liver cancer, the big one, and show them, okay, this take from the real patient who died already, and that is kind of shock therapy. And then from that, so we should mention about how it can cause the cancer. And when the people in the community, especially the people in the family or their close friend die from the CCA, so it's kind of like a alert about prevention and control. We think that in this case, we can like urge them like regularly about this. Of course, that some people is kind of like they stubborn and they don't change. Okay, we don't force them, but we show that when we do the implementation, it can decrease the infection rate, and also that people feel better. And together with the community, they propose that the way the regulation of the village about like lending the money, and they have the spy to seek which family that still eat raw fish, something like that. So it's kind of the community they manage by themselves. Mm-hmm.
Okay, thank you, Dr. Sirikachorn. From Clarissa Yvonne Domingo, this one is for Dr. Hidayat. I would like to know where and who mans the isiknas, Is it an independent agency that mediates all multi-sectoral agencies to send information, or is it under the administration of the Ministry of Animal Industry or the Department of Animal Industry, if you have that in Indonesia?
Okay, thank you for the question. It's for the e-sickness itself, we manage under the Ministry of Agriculture.
Okay.
So it's under the Ministry of Agriculture. There's a Directorate General of Livestock and Animal Health. So we in the surveillance system, we manage the e-sickness. For the what I present in the last slide, we have collaboration with other ministry. This is Zoonotic and Emerging Infectious Disease Information System. It is a system managed separately under the coordinating Ministry of Human Development. So we have other coordinating ministry. So that coordinating ministry is coordinating the human health, animal health, and wildlife sectors.
Okay, thank you, Dr. Andy. Back to Dr. Sam Castro. From Rohani Navarro, wild pigs are known to play a role in ASF transmission. Have we looked into this aspect in the Philippines?
Wild pigs?
Yeah, wild pigs or native pigs?
Yes.
Are they known to play a role in ASF transmission or in the spread of African swine fever?
Yeah, currently, what we can say is that the program right now is focused on the control in domestic pigs. Okay, so but we are actually in consultation with stakeholders on finding out this, because this has to be this of course has to be coordinated as well with our the agency looking into wildlife. Yes, so this is the DANR. So there are efforts being made in order for us to look more into this paths of transmission if they are indeed existent. So right now the program is focused on the domestic side, but of course there are efforts that we're trying to do to be able to cover this as well.
Also to cover also the native pig racing.
We did have actually a coordination, for instance, with Dr. Synan. We had
yes.
We have constant coordination. We have webinars as well to cover biosecurity in native pig populations. We do have that current engagement. Perhaps Dr. Synan can also input.
Yes, I would like also to invite Dr. Synan to share with us activities, research on native pigs in the Philippines.
Yes, actually, what I would want to share is, or to inform the group, is we should not interchange our domesticated native pig with the wild pig.
Okay.
They are two different populations.
Oh.
And based on our observations, our domesticated native pigs are also susceptible to the ASF virus.
Mm-hmm.
And it is expected because the ASF virus is introduced into the Philippines, such that the native pigs, which may be in their distant past, may have originated from the wild pigs, didn't have the chance to develop immunity or to develop antibodies against the virus.
Mm-hmm.
That is why they are susceptible. So in this case, as Dr. Sam mentioned, we are putting our efforts together to try to develop a practical procedures or protocols to implement effective biosecurity procedures in small farms, particularly that of native pig farms. Thank you.
Thank you, Dr. Synan, for that information. We also want to ask Dr. Andy, again from Mr. Rohani Navarro. For the LIMS developed in Indonesia, how do you encourage farmers to report diseases? Is there an incentive when they get to report diseases from the field?
Okay, thank you for the question. We don't provide incentive for the farmer to report or the officer.
So, but what motivates them?
But with using the e-sickness, the farmer will get more fast response from the local vet, because local vet have an office which is far away from the village usually, and without the e-sickness they have to phone, they have to call the officer. They don't know where to report, and so they get a delay, so they have a loss in the production. So with this system, so that is the incentive for them, so they get more fast response from the officer thing.
Okay, thank you for that information. Another question. Let's take
Dr. Kim.
Yes,
can I just share some information about the supply of pork?
Okay, Dr. Sinan. Yes, go ahead, please.
Infection. Yes, in areas where that are affected with the ASF, we are experiencing shortages of pork. However, in some areas in the Philippines, considering the archipelagic morphology of the country, in some areas that are still free from ASF, they are experiencing oversupply of pork. So I think the issue now, which is already being discussed by government and the private sector, is on how to efficiently move pork produced in areas which are not affected with ASF into the urban centers, particularly here in Luzon. And I think they are now developing strategies to do that para to somehow address the shortage of pork, especially in the big urban centers here in the Luzon Island.
Yes. I think Dr. Sam is back. Yes.
Yeah.
Okay.
My apologies for I lost the connection earlier. Yes, I to add with what Dr. Sinan was saying also, I believe he was talking about how to keep our areas still free from ASF, as well as how to move those that have oversupply. And to add to that, as I was mentioning earlier, it is best for the consumers to have well-informed consumers as well. So well-informed consumers should be aware of how they purchase. It helps the government a lot if consumers look for how for instance for meat, buying meat from only reputable sources. Okay, so buying meat from reputable sources, looking the consumer awareness of looking for the necessary documentation of the meat. That's very, very important in order for us to be able to help us consumers.
Okay, thank you very much. This has been a really engaging discussion with all our speakers, but we are mindful of the time, and these are the questions that we can entertain at this point. So before we close, let me assure our online viewers that we will, for those questions that we were not able to address, we will send them to all our speakers, and hopefully they will be able to respond to your questions. And before we end this webinar, may I request all our speakers for just a short takeaway message or closing message for our online viewers. But let's start with Dr. Sam.
Okay. So I'd like to thank the SEARCA for again inviting the beer of animal industry in in presenting, for the opportunity to be able to present the government campaign against African swine fever. What the takeaway message would be, everyone really has a stake in this. Everyone has a stake in prevention of African swine fever and other diseases as well. So stakeholder engagement is paramount, which is why we have to maintain we have to maintain our engagement with our different stakeholders. So yeah, we'd like to thank again SEARCA and the other speakers as well for, yeah, this is also learning for
Yes.
everyone. So thank you very much for your
Thank you, Doc Sam. How about you, Dr. Andy?
Okay, thank you again for the SEARCA for this opportunity. This is a pleasure for Indonesia to be shared our information system and our I think best practice in Indonesia. And I think for this opportunity, we have the advantage of developing technology in these days. So we need to identify which technology is best applicable for our situation in the country. So, and we can make that most effective for disease reporting on and other things. So thank you again for SEARCA and all the speakers. Also learning from me. Thank you.
Yes, thank you, Dr. Andy. Thank you so much for your time. Dr. Synan?
Yeah, the COVID-19 pandemic and the outbreaks of animal diseases that we are experiencing now may be causing us problems and some difficulties. But my advice is to never lose sight of the opportunities that these problems, that these health emergencies may be opening for us. Thank you very much, SEARCA, for this opportunity.
Thank you also, Dr. Synan, for joining us this morning. And last but not least, Dr. Chorn.
Okay, thank you, SEARCA, for invitation. And the take-home message that I would like to convey to you all is about, first you have to identify your own problem, and then you use the systematic thinking, holistic approach to do that. And when you deal with the community, you have to make them feel about the ownership to solve the problem. And also, it's not only one solution. It has like a multiple attacking for the good result. And of course, to make it sustainable, so you need the government support and including the policy. That's all.
Thank you so much. Once again, with SEARCA, led by our director, Dr. Glenn B. Gregorio, we would like to express our sincere gratitude to all our speakers this morning, Dr. Sam, Dr. Andy, Dr. Synan, and Dr. Chorn, for taking time to join us today. And thank you for your presentations, which significantly contributed to our understanding of animal diseases, what the government is doing, the tools that have been developed, the information systems that have been developed to address emerging animal-borne diseases, and what we as ordinary citizens can do to help in the fight against these diseases, especially during this COVID-19 era. That ends our webinar this morning, but please let us know what you think about this webinar by clicking the link to a quick feedback form, which will take you just a minute to accomplish in the SEARCA FB event page. And if you are registered via Zoom, you will be redirected to the feedback form before you leave the webinar room. Your feedback is important to us to help us improve the webinar. For those who wish to receive an e-certificate for participating in today's webinar, please visit the link shown on your screen. Please note that we will only accommodate requests for e-certificates within 24 hours after the end of this webinar session. We would also like to inform everyone that we issue more than 100 certificates after each webinar, so kindly wait for your e-certificate to be issued within 10 working days. I repeat, kindly wait for 10 working days for your e-certificates. And thank you for your understanding and patience. Please join us again for our next webinar session next week, July 15. And our topic is innovative wealth creation through wise savings and investments. And we will have no less than our Deputy Director for Administration, Mr. Joe Florendo, SEARCA's Deputy Director for Administration, and he is also a Professor of Accounting in UP Diliman. This is under the priority thrust of SEARCA on agri-value chain financing and investments. So we will be tackling the first part, which is on innovative wealth creation through wise savings and investments. Okay, we also have invited other speakers for our next webinar, which will focus on agri-loan and linking systems to discuss about financial technologies or fintech. Okay, so let us help one another get through this COVID-19 pandemic. And we hope that as we go along, we will be able to create a community of bigger, better, and smarter farmers and farming communities. This is Kim Bandayan of SEARCA. Stay safe, stay healthy. Thank you so much.
Thank you.